Hello, everyone. My name is Ahmed. I'm a third-year pathology resident, and today I'm going to be talking about acute basophilic leukemia. This is a subtype of acute myeloid leukemia with basophilic differentiation that lacks defining genetic abnormalities. One of the factors that are suspected in the pathogenesis is recurrent MYB-GATA1 fusion, which is seen in infant boys. This fusion promotes basophilic differentiation. Morphologically, it is characterized by hypercellular marrow with blast infiltration. The blasts are medium to large in size, and the cytoplasm contains a variable number of coarse basophilic granules and no outer rods. Immature basophils constitute about 20 to 80% of the cellular elements in the bone marrow and are characterized by irregular or segmented nuclei with relatively clumped chromatin and varying number of coarse basophilic granules. By flow cytometry, the blast population can be identified, and sometimes you can identify a blast population and a population of cells showing basophilic maturation. The blasts are usually positive for CD34, CD11b, CD13, CD33, CD38, CD123, and CD203C. The blasts may express CD9 and weak CD117, but are usually negative for HLA-DR. And generally speaking, basophils are CD123 bright, but are negative for HLA-DR. Another population of cells that is CD123 bright is plasmacytoid dendritic cells. And the way by which you can differentiate basophils from plasmacytoid dendritic cells in general in flow cytometry is by looking at HLA-DR. Basophils are HLA-DR negative, and plasmacytoid dendritic cells are HLA-DR positive. As I said, it is characterized by weak CD117 expression, and CD117 shows strong expression in abnormal mast cells, distinguishing mast cell leukemia from acute basophilic leukemia. So CD117 can be used to differentiate acute basophilic leukemia from mast cell leukemia. The essential criteria to make a diagnosis includes identifying at least 20% blasts with increased immature and mature basophils. The blasts and the basophils may be metachromatic on toluidine blue staining, and they show negative, and they are negative for myeloperoxidase, Sudan black B, and nonspecific esterase. The blasts should be positive for at least two myeloid-associated markers like myeloperoxidase, CD13, CD33, and CD117, and the leukemia should not be fulfilling criteria for acute myeloid leukemia types with defined genetic alterations or myeloid neoplasm post-cytotoxic therapy. The differential diagnosis for this entity includes blast phase of a myeloproliferative neoplasm, specifically chronic myeloid leukemia, as well as other acute myeloid leukemia types with basophilia, like AML with DEC-NUP214 fusion. And other entities in the differential diagnosis are acute myeloid leukemia with BCR-ABL1 fusion and mast cell leukemia. A desirable criteria is identifying blasts that are positive for CD9 or CD203C and negative for HLA-DR. This is the end of this video, and see you next time.